Good afternoon, everyone. Myself, Dr. Kirti, from Physiotherapy department. Today, we'll discuss about kinetic chain exercises. So, the human body is made up of 206 bones, 340 joints, 640 muscles, and 900 ligaments. So, none of these structural components work individually. They work together to prevent or allow motion, to produce strength, stability, or allow locomotion. So, the body works out in the same way as the cogs of the wheel in a watch. So in the rotation of one component create movement or action at another. So due to this reason, the injury location may not be the force behind it. So if we look at our body, there is a series of moving cogs, chains, links. The interconnection from top to bottom, the left to right becomes apparent. So when we move, so it requires the coordination and contraction of many different parts of the body with nothing working in isolation. For example, the action of throwing a tennis ball not only utilizes the upper limb and shoulder, but it also relies on good core strength and coordination with your lower body. So the overall kinetic chain comes from the idea that muscle and joint present a system which is used to more effectively and professionally describe the movement process of the human body. And the kinetic chain is composed of interconnected and overlapping segments which produce force by push or pull and are prime component of the muscle activation. So what are the links in the chain from which most of the system in the body are formed? So they include feet, ankle, knees, hip and pelvis, shoulder, head. So these are the linking points from bottom to top for the kinetic chain. And in 1995, the Arthur Stendler adapted the relax theory and included the analysis of human movements, both specific activity pattern and exercise. He suggested that extremities should rather be thought of as rigid overlapping segment in series and defined the kinetic chain as a combination of several successively arranged joints constituting a complex motor unit. So this series or chain can be open or closed. So what is the difference between open and closed chain exercises? So basically there are different variables, like if the variable is distal end of the extremity, then it will open chain exercises and closed chain exercise free in space and not fixed, and closed chain would be fixed to definitely something. Then movement pattern, which is characterized by rotatory stress in the joint in case of open chain and by linear stress in the closed chain. Joint movement which occur in isolation in open chain and multiple in closed chain. Then muscle recruitment, then it would be isolated and multiple in open and closed chain respectively. Then joint axis, it would be stable during movement pattern in open chain and transverse in closed chain. Movement plane usually single and it is multiple in case of closed chain exercises. Proximal segment is stable and closed chain is mobile. Distal segment is mobile and in case of closed chain it is also mobile. And motion occurs which is distal to instantaneous axis of rotation, and it would be proximal and distal to instantaneous axis of rotation. Functionally, often non-functional, especially lower extremity, and functional. Joint stability decreased due to shear and destructive forces, and it is increased due to compressive forces. Stabilization artificial, and closed chain is known artificial, realistic or functional, and loading is artificial in case of open chain and physiological in case of closed chain exercises. Then what are the open kinetic chain exercises? So the combination of successively arranged joints in which the terminal segments can move freely. So the distal segment of extremity is free to move in space, for example waving a hand, moving the foot during the swing phase of gait, or doing a seated knee extension. These all are the part of open kinetic chain exercises. So what are its characteristics? So it is basically characterized by rotatory stress pattern at the joint. Like for example, we are doing a seated knee extension. So it is the primary stress to joint, the rotation of distal tibia and proximal femur. even though other accessory movements like rolling and translation occurs. Movement occur in one primary axis during the seated knee extension exercise, and the motion primarily occur in the sagittal plane. So basically these type of exercise allow for more isolated muscle activation because less muscle co-contraction is used to perform the movement. And biomechanical and neurological factors. So open kinetic chain exercises allow for motion in the distal segment, while movement is usually restricted to the single joint. So usually these are used to improve the strength and range of motion at the joint. So what are the characteristics of non-weight bearing? Like great shear forces, movement force, increased distraction or rotational forces, increased acceleration or resistance forces, increased deformation of joint and muscle mechanoreceptors, or increased concentric acceleration and eccentric deceleration forces, promotion of functional activities. It requires agonist-antagonist force couple. Isolation exercise use contraction of specific muscle or muscle group which produce a single plane or occasionally multi-plane we can say movement. Then these are some of the open chain upper body kinetic exercises like bench press or bicep curl, as you can see in these figures, and then chest fly, lateral pull down, tricep extensions. Then these are also some open chain lower body kinetic exercise like seated leg extension. In the second figure there is terminal knee extension exercise, hamstring curl, plantar dorsiflexion, or calf pumps. So thank you.